Hello, I'm Dr. Piyush Bajpai. I'm heading the Department of Medical Hemato-Oncology at Manipal Hospital, Dwarka, New Delhi. And this is the month of September. This is also Blood Cancer and Lymphoma Awareness Month. So today I'll be talking about lymphoma, basically, which is one of the most important entities and highly curable malignancies. And this is, of course, a challenge, what we see in younger age group as well as in elderly. So this is a Lymphoma Awareness Month. And when we talk about lymphoma, what is lymphoma? Going a step back, it is when we talk lymphoma is like a part of blood cancer. So what are blood cancers? And blood cancers are cancer which are basically the cells of the immune system or the red blood cells. They actually go awry at times and they start producing some clones of their own, and they then become cancerous. So it's like the DNA errors or the mutations in these cells. Basically, they start producing a clone and they then become cancerous. So when we talk about lymphoma, it is a cancer of the immune system, the white blood cells, basically. And also these white blood cells, which they actually home in the lymph nodes. The lymph nodes basically are structures in our body, the lymphatic system, as you can see, as you would see that these are like tonsils, adenoids. We all know what are tonsils, and tonsils are basically gland in our mouth, and they in childhood they get swollen up in a throat infection. So it's basically a reaction to a bacterial infection. So like tonsils, these all are like lymph nodes, and these are like a size of a pea, rather smaller than that. And when they become infected, when the infection is there in the body, they can swell up. Likewise, if they become cancerous or the cells, white blood cells inside this become cancerous, then also they swell up. So basically, lymph nodes are divided into primary and secondary lymphoid tissue. The primary is basically, when we talk about primary lymphoid tissue, it is basically the spleen, the bone marrow, the thymus. And the secondary lymphoid tissue is these lymph nodes, which are all distributed all along our body. There are two types of cells, the white cells, which are there. And one is the B cell and the T cell. So when we talk about the B cell, basically these are supposed to generate antibodies. And antibodies are like bullets. And these B cells, they generate antibodies, and these antibodies can actually kill the bacterial infection, the viral infection. And basically these B cells mature in their lifespan to become a plasma cell, from a pro-B cell to a plasma cell. The pro-B cell, the initial B cell, cannot produce antibodies. However, the plasma cell can produce a lot of antibodies. And therefore, the journey between these antibodies become the markers of the lineage of these B cells. And we can talk about it. The B cells actually undergo certain mutations along their journey. So when we talk about their journey, they actually, when they are in, they are exposed to an antigen, they enter the lymph node, and then they undergo a process which is called somatic hypermutation. There's a lot of changes. There are a lot of permutation and combinations which happen, and then antibody is eventually formed from these particular cells. And then basically they become mature and become plasma cells, and then they can secrete one type of antibody. So their identity is from the antibody they produce. And therefore, if these B cells become more in number, have their own clone, they will produce one type of antibody, and therefore we can identify a clone of B cells from the antibodies they produce. On the other hand, there are T cells. The T cells are basically two types again. cytotoxic T cells, the helper T cells, and another one which is called the memory cells. The T cells basically, they would actually go straight away to the bacterial infection, the viral, or any of the infection, and they will actually do a direct killing. The antigen would be presented to the T cell, and the T cell would actually, not from a distant, like they will not use antibody, but they will actually go and straight away kill that cell, the bacterial cell. The helper T cells actually generate a lot of helper T cells and the cytotoxic cells to come to kill that particular bacteria. Likewise, there are NK cells, which are also called natural killer cells, and these are found majorly in the skin surface, below the skin surface, in the liver tissue. So these cells basically again are activated and can directly kill the bacterial cells or bacterial infection or the viral infection. So these are basically direct actions from these particular T cells and NK cells. So basically, when we talk about lymphoma, any of them, the B killer cell, any of the lineage clones can cause lymphoma. Any of these B cell, T cell, or natural killer cell, they can actually, one of their clone, which can go aberrant, which can go anarchic against the body, they can form a lymphoma mass, and they can actually, cause symptoms. Well, what are the causes of these symptoms? The causes are whether it could be occupational exposure, like some exposure to pesticides, whether it could be infectious organism. For example, there is a bacteria in our stomach which is called Helicobacter pylori, and it can cause a malt lymphoma, a mucosal lymphoid tissue lymphoma, which is basically a indolent sort of lymphoma, this indolent type of tumor, but this Helicobacter pylori can cause it. Likewise, there is this notorious Epstein-Barr virus and cytomegalovirus, which can cause various sort of lymphomas. HIV infection can itself also, because of low immunity, the lymphoma can develop in these patients. So in patients of acquired immune deficiency syndrome, which is also called AIDS, we can see that lymphoma can develop. Then there are drugs which can cause long intake of these drugs like steroids or immunosuppressant drugs, which are given to patients who have undergone some organ transplant like renal transplant or liver transplant. So when these chronic immunosuppression is given, it can be the immune system can go down, and these lymphoma or these cancers can come up. And then there is autoimmune diseases like rheumatoid arthritis or Sjogren's syndrome. These are also causes of lymphoma at times.